too. Wow. Well, thank you so much for that extraordinarily generous introduction, and thank you all for coming to hear me read this, I guess, afternoon now. I wanted to make my reading for you today a kind of enactment of some of the themes I've been talking about in various settings during my visit relating to poetry and healing, and in particular how poetry has relevance in the work of physicians, but also as something that is very, very powerful for patients to encounter as they experience illness. And to do that, I wanted to start with a poem that I wrote at a time that I'm sure many of you remember. All of us, I think, remember where we were on that terrible day of 9/11. I was in my clinic seeing patients that morning, and I always remember the images on the television screens in the waiting room of what was happening, and this collective sense I had with my patients, that we had to somehow make sense of this wound, that I didn't really have any medicine that I could offer to help heal, but somehow our language, our narration of what was happening, of what we were seeing, seemed to perhaps be actually more useful, more valuable. So I'm going to start with a poem that I wrote at that time in a kind of chorus with the voices of some of my patients. And this is a poem called "The Enemy." The building's wounds are what I can't forget. Though nothing could absorb my sense of loss, I stared into their blackness, what was not supposed to be there, billowing of soot and ragged maw of splintered steel, glass. The building's wounds are what I can't forget. The people dropping past them, fleeting spots approaching death as if concerned with grace. I stared into the blackness, what was not inhuman, since by men's hands they were wrought. Reflected on the TV screen, my face upon the building's wounds. I can't forget this rage. I don't know what to do with it. It's in my nightmares, towers, plumes of dust, a staring in the blackness. What was not conceivable is now our every thought. We fear the enemy is all of us. The building's wounds are what I can't forget. I stared into their blackness, what was not. When I first imagined a career in medicine, I didn't think I was likely to succeed for actually a lot of reasons, but I remember first thinking about my faith and not seeing much of a spiritual life among physicians. I thought that would be a problem for me if I became a doctor someday. And then I remember reflecting on my ethnic identity, my ethnicity, being a Latino, and I didn't have many Latino role models to inspire me to have a career in medicine, so I thought that might be another kind of challenge for me. And then, of course, is the fact that I'm gay and I'd experienced enough homophobia in doctors' offices at a young age. I imagine that might be the biggest obstacle I had to this dream of becoming a physician someday myself. And as it turned out, when I finally got to Harvard Medical School, it was the fact that I was a poet that was so problematic. All these other identities, all these other anxieties in a sense that I had, they certainly posed some challenges for me, but being a poet really freaked out my colleagues and definitely my attendings. And I always relished the irony of that story in telling it, because I can't imagine now in the work that I do the absence of poetry, the absence of language in my work. It's so central to what I do every day in forming empathetic relationships with my patients, in really being able to understand and be present at the metaphoric language that they use to describe their pain and their suffering. And so I wanted to read this next poem as perhaps a way to locate me in relation to some of these identities, which I think actually, rather than being ways that distance me or disconnect me from others, like poetry, actually bring me closer to the infinite variety of all of us. And really, I think, like poetry, helps me to be more present for all of my patients. So this is a poem called Latinos. Another avocado and I'm done. The guacamole I prepare is for the Super Bowl, a party for a game we watch because Americans love football, and after all, we want to be like them. A couple drops of hot sauce and I'm done. I spoon the guacamole into bowls. You say you love to watch football games. I say, you're Puerto Rican and we're gay, so really, must we host this stupid party? A sprig of fresh cilantro and it's done. You taste the guacamole, then you smile, reminding me of why I married you. It's just a game, I think. Mi maricón, you say, and pat me gently on the butt. The guacamole finally is done. You sure you aren't a little Mexican? This guacamole is delicioso. I tackle you onto the couch. We kiss a while, watch J-Lo in a Pepsi ad. I feed you chips with guacamole. Done with games, I ask you seriously, not in Spanish, but almost as grave. Is it too late to reconsider? Suddenly, you look delicious, like Lorca, surreal. I taste the guacamole on your tongue. The Super Bowl is just a game, you say. Miami versus San Francisco, sea to shining sea. We sing beneath the strobes and stars, beside Americans like us. So one of my jobs now, I guess I could say as a faculty member at Harvard Medical School, my alma mater in a way, is to think about the ways in which poetry especially, but literary writing and the humanities even more broadly can be useful as a tool for helping our learners, our medical students, our interns and residents think about and understand and perhaps even practice empathy. And empathy, as you can imagine, is a very difficult capacity to even describe, never mind teach. And in fact, many of my colleagues say to me now, you can't really teach empathy, so what are you doing here? Why are you reading poems to your medical students? But I think actually that even if we can't didactically teach empathy, I do think we can do a much better job of modeling empathy for our patients, and with our patients rather, for our students and residents. And one of the ways perhaps we can model empathy is through sharing poems, through sharing narratives, through really, in that process, showing our own vulnerability, showing ourselves to be perhaps in not so many ways different from the people we care for. So this next poem is perhaps a kind of enactment of empathy. It's called iatrogenic, which is a medical term, and I should probably define it. Iatrogenic refers to something, usually a treatment that actually causes harm rather than helping the patient. So this is a poem called Iatrogenic, which again perhaps is a kind of interrogation of empathy. You say, I do this to myself. Outside, my other patients wait. Maybe snow falls. We're all just waiting for our deaths to come. We're all just hoping it won't hurt too much. You say, it makes it seem less lonely here. I study them as if the deep red cuts were only wounds, as if they didn't hurt so much. The way you hold your upturned arms, the cuts seem aimed at your unshaven face. Outside, my other patients wait their turns. I run gloved fingertips along their course, as if I could touch pain itself, as if by touching pain, I might alleviate my own despair. You say, it's snowing, Doc. The snow, instead of howling, soundlessly comes down. I think you think it's beautiful. I say, this isn't all about the snow, is it? The way you hold your upturned arms, I think about embracing you, but don't. I think we do this to ourselves. I think the falling snow explains itself to us, blinding, faceless, and so deeply wounding. One of the reasons I believe that poetry may also have a therapeutic value for people who are living with illness is actually because of the example of many of my writer friends who have engaged with creative self-expression broadly, but many writers especially, who I think really have lived longer and have lived better as a consequence of their writing in the face of mortal illnesses. For example, breast cancer. This next poem I want to read is for one of my teachers, one of my mentors, a poet and critic by the name of Eve Sedgwick, who when I was a student at Amherst College first encouraged me to pursue my passion for healing through writing poetry, and who was diagnosed not too long after I graduated from college with metastatic breast cancer. And she wrote about that experience in poems that are, I think, indelible and still I come back to over and over again. And she ended up living about 12 years after her diagnosis, which is extraordinary. She was told at the time she probably didn't have longer than a year or two to live. So perhaps there's something about that creative engagement with the experience of suffering that does have healing power in a way that we haven't yet figured out biomedically. So I want to read this poem for Eve. It was written for her, but also to remember her. Heart grow fonder. The leg bone's connected to the shin bone. An apple a day keeps the doctor away. A little voice inside me said, beware. A tumor big as a grapefruit killed her. Tamoxifen, oxycodone, Bengay. The breastbone's connected to the rib bone. Like a patient etherized, I can't say what evening looks like, but I feel alone. A little voice inside me said, unfair. My brain's a sieve, she'd say. We mourned her hair. She'd get lost on the way to San Jose. The rib bone's connected to the backbone. I plunged my heart in San Francisco Bay. A scar across her chest. One breast was gone. A little voice inside me said, I'm scared. Some final pleasures, slices of ripe pear, massages strangely not unlike foreplay. The backbone's connected to the neck bone. Old voicemails from her that I still replay. Physician, heal thyself, sweetly intones the little voice inside me I can't bear. We'd read together almost every day. After great pain, a formal feeling comes. The neck bone's connected to the head bone. A little voice inside me says, beware. So, whenever I read this next poem, which I often do, I'm reminded how much our patients actually take care of us in medicine, something that we rarely acknowledge. But another reason I think poetry can be so important for doctors, for other care providers, because it does help us, I think, to mark those kinds of experiences that we have when we actually feel cared for by people we are treating. And the patient you'll meet in this next poem is one I'll never forget. I took care of him when I was doing my pediatrics rotation, actually during medical school, and I was paged in the middle of the night. I was on call with my team by his nurse to put an IV in his arm, and so I gathered all my stuff and trudged up to the bedside and had my little, set up there and trying to get the IV into his arm, and he tried once and, no luck. tried again, still no IV, trying a third time. The sweat is starting to trickle down my forehead. The nurse is glaring at me from across the room like, "You incompetent fool, you're torturing this poor kid." And, as I'm trying for probably the third or fourth time, he looks up at me with these huge eyes and says, "Doctor, don't worry, you're doing a really good job." And I was just floored in that moment by, this 5-year-old. I see these kids running around, this afternoon, and, a 5-year-old who had the capacity to empathize with me and to identify with my distress and to reassure me in that way was just an unforgettable moment. So I wanted to remember him with this poem, which is called Age 5, Born with AIDS. In Jaime's picture of the world, a heart as big as South America shines out, the center of the only ocean. 3 stick figures, one is labeled me, are drawn beside the world as if such suffering could make us more objective. Jaime is bald and has no mouth. His parents aren't like him. They're all red lips and crazy yellow hair and grins. There is no title for his work of art, except the names we give ourselves. Whenever I read these next poems, which I also often like to share, folks will come up afterwards and say, "Oh, those poems you read towards the end, they really remind me of that television show. They used to say ER, now they say House or one of those other medical shows." And so then, of course, the next question is, well, so do you watch these shows? And then I have to kind of sheepishly admit that I'm kind of famously addicted to these shows, and it's really all the more sort of sad and pathetic because I spend most of my time dealing with these kinds of situations in my real life. So why do I do that? But actually, when I read these poems, I'm really hoping to do something I think is a little bit different from what some of those television depictions of physicians and patients tend to do. And in these poems, I hope I'm really trying to dignify and to really elevate and make heard some of the voices of people I've had the privilege to care for who I think often are silenced, are not heard, are marginalized in our larger culture. And I'm certainly not interested in aggrandizing my own role in these narratives, but really sort of questioning my stance as a provider of care and my privileges and my power in these relationships. And also as a kind of further question to try to use the medicalese that I think we often deploy as a kind of weapon to keep patients at a distance and to, in some ways, really diminish them, to try to revisit that language and to see what possibilities it might have for expressing beauty or hope or, again, dignity. So these poems are for my patients, and you'll probably recognize they're sort of broken sonnets, and the sonnet, of course, is a love poem. So they're also kind of an exploration of the possibility of loving patients and how care can be an expression of a kind of love. So this is a series of poems called 10 Patients and Another, and I'll just read some of them. Mrs. G. The patient is a 60-odd-year-old white female who presents with fever, cough, and shaking chills. No further history could be elicited. She doesn't speak. The patient's social history was non-contributory. Someone left her here. The intern on the case heard crackles in both lungs. An EKG was done, which showed a heart was beating in the normal sinus rhythm, except for an occasional dropped beat. An intravenous line was placed. The intern found a bruise behind her ear. She then became quite agitated and began to sob without producing tears. We think she's dry. She's resting quietly on Haldol now, waiting for her bed upstairs. Jamal. The patient is a 3-year-old black male, the full-term product of a pregnancy that was, according to his grandmother, unplanned and may be complicated by prenatal alcohol exposure. Did okay, developmentally delayed but normal weights and heights, until last week when he ingested what's turned out to be cocaine, according to the lab results. His grandmother had said she'd seen him with some baby powder on his face and hands before he started seizing, and they brought him in. The vital signs have stabilized. The nurse is getting DSS involved. The mom? She left it on the kitchen table. That's her, the one who sings to him all night. Kelly. The patient is a 12-year-old white female. She's gravida 0, no STDs. She'd never even had a pelvic. 1 month nausea and vomiting. No change in bowel habits. No fever, chills, malaise. Her school performance has been worsening. She states that things at home are fine. On physical exam, she cried but was cooperative. Her abdomen was soft, with normal bowel sounds and question of a suprapubic mass, which was non-tender. Her pelvic was remarkable for scars at 6 o'clock, no hymen visible, some uterine enlargement. Pregnancy tests positive ×2. She says it was her dad. He's sitting in the waiting room. SW. Extending from her left ear down her jaw, the lac was 7 centimeters long. She told me that she slipped and struck her face against the kitchen floor. The floor was wet because she had been mopping it. I guess she'd had to wait for many hours since the clock read nearly midnight. Who mops floors so late? Her little girl kept screaming in her husband's thick, impatient arms. He knocked 3 times, each time to ask when we'd be done. I infiltrated first with lidocaine. She barely winced and didn't start to cry until the 16th stitch went in and we were almost through. I thought my handiwork was admirable. I yawned, then offered her instructions on the care of wounds. She left. Manuel. In Trauma 1, a gay Latino kid, I think he's 17, is getting tubed for respiratory failure. Sleeping pills and Tylenol, I translated for him as he was wheeled in. His novio explained that when he told his folks about it all, they threw him out, like trash. They lived together underneath the overpass of Highway 101 for 7 weeks, the stars obstructed from their view. For cash, they sucked off older men in Cadillacs. A viejita from the neighborhood brought tacos to them secretly. Last night, with 18-wheelers roaring overhead, he whispered that he'd lost his will to live. He pawned his crucifix to get the pills. FP. Another AIDS admission. This one's great. They bring him in strapped down because he threw his own infected shit at them. You better bring your goggles and a mask. We think he's got TB. He's pissed as hell. Apparently he wants to die at home, but somebody keeps calling 911. A relative back home in Iowa or some damn place. Just keep him snowed with Ativan. Believe you me, you do not want to get to know this fucker. Capaces all over, stinks like shit. Incontinent, of course. How long before you get down here? Because his nurse is driving me insane. Of course we got blood cultures. Yeah, a gas. Okay, I'll stick him one more time. The things you do for love. Maria. This G2, P1, gives us a confusing history. It sounds like she's been pregnant approximately 30 weeks, although she can't recall her LMP. No pain, but bleeding for about 2 days. Of course she hasn't had prenatal care, and God only knows where the father is. She works 2 jobs that keep her on her feet all day. She's been in the United States 6 months and doesn't speak a word of English. Bet you she's illegal. Cervical exam is unremarkable. The os is closed. I think we need an ultrasound to tell us more. Besides a look at her placenta, we need some confirmation of her dates. Her uterus can tell us more than she can. Jane Doe number 2. They found her unresponsive in the street. Beneath a lamplight, I imagined, made her seem angelic, regal even, clean. She must have been around 16. She died who knows how many hours earlier that day, the heroine inside her, like a vengeful dream about to be fulfilled. Her hands were crossed about her chest, as though raised up in self-defense. I tried to pry them open to confirm the absence of her heartbeat, but in death she was so strong, as resolute as she was beautiful. I traced the track marks on her arms instead, then pressed my thumb against her bloodless lips. So urgent was my need to know. I felt the quiet left by a departing soul. So not too long ago, I gave a reading at Oberlin College, a place not unlike Amherst, where students had organized some events to mark World AIDS Day. And after I gave my reading, one of the students came up who had organized many of these events and said to me, it's so great that you're still writing about HIV and AIDS because, now that we have a cure, it's important for people to still know about it. And it just struck me, in hearing her talk about this, that, what we do sometimes in medicine is overhype these advances that we have that are wonderful and powerful, but sometimes they can actually be really misleading and can create a sense of, we're post-emergency. Meanwhile, as we marked on that occasion, there are 40 million people on this planet living with HIV infection, and most of them are going to die of complications of the disease because they don't have access to the miraculous treatments that we have here in this country. So it's not a critique or a comment on her, it's really more about what we do in medicine and how we, again, I think, in many ways, overhype what we are able to do with our treatments and with our science. So I wrote this poem actually in response to that encounter, and it's called Recent Past Events, and I'll share that with you now. It wasn't so miraculous back then. Some said we had their blood on our prim hands. We were ashamed of our good appetites. We marched together in gay pride parades. We feared their blood. We prayed for it to end. We learned the names of lands in Africa, Botswana, Ghana, Tanzania, Chad. We adopted universal precautions. We prayed for it to end. We feared their blood. We were afraid to call our parents, who we knew would think the worst. We learned to speak in acronyms. We watched 2 women kiss on television late one night. We cried. We handed out free condoms in the fens. Remember when it seemed miraculous that most of our close friends weren't dead? We feared their blood. We were ashamed. We went on trips to Africa. We saw a leopard kill an antelope. We saw the vast red dunes Namibia is famous for. We cried at patients' funerals. We handed out clean needles in the fens. We feared their blood. We touched each other carefully at night, remembered when it felt miraculous. Remember when his cheekbones didn't jut so much? We had their blood on our clean hands. We were ashamed of living while they died. We cooked for friends. We prayed for it to end. We traveled to Peru, New Zealand, France. We bungee jumped from cliffs. We sipped red wine. We shopped for clothes that fit us well. We watched the president announce more funds. We cried. We were ashamed of our good appetites. We watched two women kiss outside the door of our favorite Chinese restaurant. We talked about adopting kids. We feared what people thought of us. We bought a house. We painted the back bedroom red like blood. We gave less money to the charities. We found a nice church that accepted us. The stained glass windows seemed miraculous. We ate our dinner. We remembered how we feared their blood and how we prayed for it to end and how it never really did. I hope I've given you some sense of the connections between poetry and medicine. I want to do that maybe a little more explicitly by reading a couple of paragraphs of an essay, and then I have one last poem to share. And then I hope we have a little time for questions. This is a couple of paragraphs, as I said, from an essay I wrote a long time ago now called AIDS and the Poetry of Healing. In poetry are present the fundamental beating contents of the body at peace, the regularity of resting brainwave activity in contrast to the disorganized spiking of a seizure, the gentle ebb and flow of breathing or sobbing in contrast to the harsh spasmodic cough, the single-voiced ringing chant of a slogan at an ACT UP rally in contrast to the indecipherable rumblings of AIDS funding debate on the Senate floor. The poem is a physical process, is bodily exercise. Rhymes become the mental resting places in the ascending rhythmic stairway of memory. The poem, perhaps, is an idealization or a dream of the physical, the imagined healthy form. Yet it does not renounce illness. Rather, it reinterprets it as the beginning point for healing. I wonder then whether poetry might also be therapeutic. Many of my friends, especially some of my colleagues in medicine, have teased me for believing in the curative power of words, joking that I should write some doggerel on my prescriptions instead of the names of medications and directions for their use. If poetry is made of breath or the beating heart, then surely it's not unreasonable to think it might reach those places in the bodies of its audience, however rarefied. Moreover, I joke back, I have never seen a poem cause fulminant liver failure or bone marrow toxicity, even a really bad one. Putting the mouth to words, and by incantation returning regular rhythms to the working lungs, these were the principles by which ancient healers in Native American cultures practiced their art. The Egyptians gave their dead a book full of charms and spells to be used in the afterlife. Might not poetry then facilitate the passing to another realm? Poetry is a pulsing, organized imagining of what once was, or is to be, what life once was, what life could be. It is ampules of the purest, clearest drug of all, the essence and distillation of the process of living itself. And this is my last poem. Before I read it, I want to thank all of you for coming again. I hope you could hear me okay, and I do hope you have questions, comments, cries of outrage. This is a poem that I think in some ways says goodbye, or is about endings and beginnings. And I should also specifically thank Tilts for having me here. Thank you so much for making my visit possible. So this is a poem called Guzzle by the Sea. A Guzzle is a very, very old Iranian or Persian form. It's also repetitive. As you can tell, I'm a little bit obsessed with repetitions. I think because I spend a lot of time rounding in the hospital. So anyway, this is a Guzzle called Guzzle by the Sea. We always wanted a house by the sea, a place to grow old together by the sea. My father's house in Guantanamo stolen. He still tastes arroz con cangrejo served by the sea. That whitewashed house in Greece, perched on a bluff, dream home to tourists, views of migrants drowned by the sea. Those hovels in Mexico, they turned into condos. No fishermen left to be nourished by the sea. We looked into the Maldives, imagined a paradise slowly vanishing, sand swallowed by the sea. Poets love islands, as if only love and not war can be so utterly surrounded by the sea. Yet the wars continue. In the West Bank, a child blown to bits, playing by the sea. What else to do but imagine flight, the respite of seagulls, their harmless dive bombing? By the sea, it almost seems possible change is near. Our greed seems small when we stroll by the sea, even innocent. In rainbow lays, once we took vows that seemed to rhyme with the palms by the sea. A luckier child builds sandcastles and buries his uncles up to their necks by the sea. The cottage in Provincetown, bought in foreclosure, its last owners dead of AIDS, in graves by the sea. Today, we rest on the beach, dreaming our silly dreams. We accept the lies made up by the sea. We look to the horizon. Behind us, beyond the dunes, a field gathers dew. Waves lap. We end and begin by the sea. Thank you. Thank you very much. I hope you have some questions for me. I think we have a little time. I could look at my iPhone, but that's terrible. I don't want to do that. Yes?
When do you find time to write, and do you write something every day?
I do. I try to write every day. I try to make that a kind of a practice, a meditative kind of practice for me, but also I find if I don't do that, I think I am at risk for medicine consuming my entire existence, my entire life. And maybe that's a little unfair to say that, in a kind of a dichotomized way, because my writing practice, I think, really is part of my practice of medicine. So maybe medicine is consuming me, but in a different way. So I do try to write every day. I'm lucky. I'm kind of a night owl, so I stay up late. Maybe this was something that happened to me because of my medical training. I learned to be able to stay up all night all the time. So yes.
I would like to know what you think with the stigma behind HIV and AIDS is still very present today, and with the treatments we have right now, things like that, but also 40 million people being affected still. How would you explicate that to somebody, or how would you explicate that to somebody that may not be as informed on present day crisis rates?
Yeah, that's a really great question. We really struggle with how do we continue to educate people, both sort of in a public health sense, but also in a human sense about the nature of HIV, how many people it still affects, how we can avoid more people becoming infected with HIV. And so that's a really I wish I had the answer to that question, because it's such an important one. But I do think that not the sort of standard public health approach, which is again very didactic and can sometimes actually alienate people who may want to know more about HIV, but find that that kind of language or that kind of gesture very inhuman, depersonalizing. I think poetry. I think other media. A colleague of mine who produces some of those TV shows I mentioned. Says that when they did a show on domestic violence, the domestic calls to domestic violence hotlines in Los Angeles, skyrocketed, showing that, perhaps all those public health pamphlets that I have in my office, that say, here are the resources if you're, experiencing violence from a partner, call this number. Somehow that message isn't getting through, but put it on a TV show and people respond. So I think we have to think really creatively about, how we get those messages out. And again, I think media, poetry, literature, art can all be very, very effective ways of communicating about health and disease. Yes, sir.
In trying to convey to your students, or your younger students, seeking to be physicians, what of your books or poems do you use the most in conveying what it is to be a physician?
Well, I rarely, if ever, inflict my own work on my students. Sometimes, on occasion, I've shared a poem only to say, look, you can write a poem. I write poems, so, but I usually don't ever assign my work. But I guess if I had to say one work that maybe is most relevant, I mean, I have a new and selected book of poems coming out, which kind of touches on a lot of the issues I've addressed in my work over the years. And when that comes out, that would be the one I would probably. It's going to be out next. Well, as books of poetry go, we're saying next, actually this fall, but it'll probably be the spring of the coming year. So, Duke University Press. Thank you for asking. So that would be probably the one, but yes.
First, I'd like to thank you very, very much.
Oh, thank you.
This has been, I really, really have loved it.
Wow, thank you.
Hearing your voice
Thank you.
and from the inside out. And I just wanted to give you a compliment on the one poem that I love the way you slipped the line from Willie Dickinson. So beautiful.
Well, thank you.
And my other question is, do you feel a connection to William Carlos Williams, the other physician who wrote poetry, and because he was an obstetrician and had to wait on the babies, often found himself in the middle of the night?
Mm-hmm. Well,
Curious.
yes. Well, thank you for that question. I do. He's one of my heroes. He worked with impoverished patients, working class patients, the same kind of patients I care for, and he wrote poetry, as you say, and he wrote poetry that I think of as really being a truly American poetry in an idiom, in a democratic language that any of us can understand. He was really interested in making a poetry that could be heard and loved by everyone, and not that elitist,
I feel you doing the same thing, out of the
Oh, thank you.
generosity of your own experience and the comprehension of your own experience.
Wow.
I hear your voice always.
Wow. Well, that's a great compliment to be compared to my hero. I mean, I can just be quiet now. Thank you. Thank you very much. Yes. Yes. In fact, I was going to read a poem, but I also didn't want to keep folks too long. But yes, I do lead writing workshops for patients often, and I think it can be extraordinarily powerful for folks to come together in community, because as any of us who's experienced illness knows, living with cancer especially, I think, but many illnesses can be very isolating and really disconnecting from our support networks, even from our own sense of who we are, when our bodies betray us. And so coming together in that kind of a group where we raise our voices together and find a kind of comfort in, I'm not alone in going through this, beyond just the actual art making, the imagining of beauty, the imagining of hope, the imagining of those kinds of aspects of life that, again, the experience of illness seems to obscure from us often, because we are in the hospital, which is not a beautiful place usually. It's not a space like this where we have art, where we have the human voice, where we have that empathetic, data, if you will, all around us. We have machines, we have technology, we have needles, we have other kinds of torture devices, omnipresent. And so So yes, that can be such a comforting, especially when we do it in the hospital space. It can be such a kind of oasis of I think, of a kind of healing that really is necessary for people, again, especially who are hospitalized. It can really be, I think, very powerful. And we're not, necessarily writing to, publish our poems or to, it's about more process than product. And so yes, so I do. That was a longer answer than I should have given. Yes.
Do you publish a lot of your work, a lot of your raw material, if you have to go back and edit your material?
Yes,
Do you publish it?
I do. I think that, and that's one of the things I work on the most with my students is, teaching that writing, again, is a process, that it's, when I was very, very early in my own writing, I used to feel like I crafted a poem and I couldn't, once it was on the page, that was it. It couldn't be, if I took out anything or changed anything, the whole poem would implode and it would, but I have learned through my own experience and then also reading poets whose work I love, that actually poems can be made better through more constant attention, through revision, through having a kind of dialogue with other things I'm reading, so that I come back to that poem and in that new context and, something else changes or shifts in the writing. So I do think that, especially because I'm also particularly obsessed with craft and with formality and the implications of writing in form. So I really, I'm thinking often very, very critically about, even if I break a line, what my intent is in doing that and what meaning I convey in doing that. And that doesn't happen, I find, more and more just like randomly or sort of spontaneously because I'm such it's work. It does require a lot of revision. So, but thanks. Yeah. Yes.
I'm wondering what you think is the correlation between poetry and being a physician. I mean, it seems to me that I had a creative writing student who had dropped out of Harvard Medical School to become a writer of prose. And so there's a lot of journals now, aren't there, that are publishing work by
Yes.
physicians. What's going on?
Well, I think we are finally, recognizing that what we do involves human beings, that our work, actually central to our work, is the experience of human suffering, the human condition. These are not new concepts. They may be, in some sense, to us because our training in the past certainly, I think, really distanced us from that notion that we're taking care of a person. In fact, what I was taught in medical school was, it was much more important to know the 18th improbable item on the differential diagnosis than to know whether my patient was actually having pain that morning. That was what was taught, that was valued, and that was really the model under which we were providing care to patients. And so I think we are discovering that, we can't deliver all of the incredible benefits of these technologies that we have if we are not able to interact with patients humanely, if we can't understand the metaphors that they use in describing their pain. Not everyone can articulate a pain score on our 1 to 10 scale. We have to be able to understand language to really to be able to say, okay, this is the appropriate medication to use in response to this symptom or this concern. There's a real practical value of knowing about the humanities in this broad sense, I think, and I think also it's really come from patients. The narratives that patients have created about their experiences of receiving the care that we have been providing that have really motivated a lot of change as well, because that kind of, in a sense, self-advocacy changes policy. And I've been to many conferences now speaking on this notion that narratives, perhaps even more than data, I'll give another small example. When I teach about health disparities, and I was telling some of the students I met earlier during my visit about this, that when I give the statistics about disparities, it can become, kind of the eyes glaze over a little bit, people are zoning out, and even though I find the numbers compelling and tragic and terrible, it's quite another thing to say, here's a poem by someone who's lived with HIV or lived with cancer, and suddenly those numbers have a human face, and that changes how we think about how we can do things differently, and certainly on the individual care provider to patient level, but also in larger policy settings as well. So yes, that's also probably too long an answer to your question, but yes, sir.
You talked yesterday at lunch about something you called the hidden curriculum.
Yes.
Which, as I understood it, was a medical training designed to keep patients at a distance.
Yes.
Removed minor players in their own life process.
In their own stories, exactly.
To what extent are you consciously working to subvert that curriculum?
Yes.
And how far do you think you and others like you are getting with this?
Well, that's a great question too, because the hidden curriculum is very persistent, and part of its success, I think, has to do with the fact that it is hidden, that it's not explicitly taught, so it's very hard to get at exactly where it's coming from to begin with, I think, and then the kind of tools we have to combat it are not still supported in many ways by medical educators, medical education broadly, even though there are more and more mandates coming from professional societies and accreditation bodies that we must teach humanism, we must teach patient communication skills, we must teach cross-cultural sensitivity, these kinds of issues that really are so, I think, in such a compelling way addressed by humanities materials, humanities resources. Medical schools don't put resources into teaching these subjects, and so that's part of the problem too. But I think that ultimately what's required, as we were saying yesterday at lunch, is a kind of a culture change that needs to happen both through medical education efforts, but also through other kinds of channels where again societal pressures, notions around valuing quality of care, measuring patient satisfaction with their experience of care, and linking how we reimburse physicians. That sadly in some ways is probably the most powerful motivator for behavior change. And so if we kind of tackle it from a lot of these different angles, I think we can be successful. And then of course hearing from patients narratively, people telling their stories, as I was just saying before, is I think really powerful, because I hope I don't ever come across as doctor bashing. I think almost every doctor I know, and they're overwhelmed, they're frustrated, the demands of the job continue to increase, and yet there are more and more pressures on how they're being paid, how we're being evaluated, more and more checklists that we have to now fill out, more and more paperwork, all these things that divide us from patients, besides our own attitudes. And so docs need care too. We need to figure out how this way of thinking about the experience of illness also nourishes and renews care providers, physicians, because I think that will help make change too. If doctors see in their own experience of providing care that it can be better for them too, that can be really powerful as well. So, but it's a complex problem, and that hidden curriculum is so deeply rooted in the culture. It's challenging. Yes, one more question from someone who. I do, absolutely, and in fact, there's a very important health economics journal called Health Affairs, and they recently had a conference, and they invited me to read some poems because they have, I think, a very strong sense that narratives, that stories, that poetry, that art really can motivate higher level kinds of change. That yes, it's valuable in the individual relationships that I've tried to represent in some ways today, but also that again, it's that same kind of phenomenon where putting a human face, telling a human story, that again enters us, through those emotional channels empathetically, actually is a much more powerful motivator for many of us. Not everyone, but it really can, I think, change policy. And again, some of the stories we hear reported in the media, again, I was criticizing a little the overhyping of some kinds of scientific advances, but some of the stories that are told in the media that relate to people's experiences of specific illnesses also can really call attention to a problem that maybe we weren't even so aware of. So yes, I think that it does have a role in that realm or that arena as well. I think we probably should wrap up. It's getting late, but thank you so much for all the great questions.
And thank you, Rafael.
Thanks again.